So Crohn's disease and ulcerative colitis are in some ways similar, but there are a lot of differences between them. They're both inflammatory diseases that involve primarily the intestine, but can also have non-intestinal manifestations, either in the skin or in the biliary system, for example. Crohn's disease is able to cause inflammation anywhere in the gut, even including the mouth, whereas ulcerative colitis, by definition, involves only the large intestine. And the other major difference between the two is that ulcerative colitis involves the lining layer of the colon and doesn't involve the deeper layers of the wall of the colon like the muscle layer, whereas Crohn's disease is typically a transmural inflammatory process, so it can involve all of the layers of the gut and even perforate the intestine when there's locally intense inflammation. Eosinophilic esophagitis involves only the lining of the esophagus and a little bit of the layer just below that as far as we know, although we've not been able to biopsy the muscle layer in the esophagus, so we don't know what impact it might have on the deeper layers. The type of inflammation that's generated in Crohn's disease and ulcerative colitis is very different under the microscope. The inflammatory cells that are involved in Crohn's and ulcerative colitis are typically neutrophils and lymphocytes, and although eosinophils can participate in those inflammatory reactions, they're not the predominant cell. In contrast, in the esophagus, eosinophils are the predominant inflammatory cell, but lymphocytes and mast cells are also increased compared to normal esophageal tissue.
Often when patients present with symptoms such as abdominal pain or bleeding or diarrhea, one thinks about a number of different diseases, including inflammatory bowel diseases, infections, and eosinophilic GI diseases. If the patient should need to undergo a biopsy, one looks at the tissue under the microscope to identify whether or not any of the inflammation cells are present. In eosinophilic colitis, the eosinophils are the predominant cells, whereas other cells such as neutrophils and features such as crypt abscesses or granulomas are present that are more indicative of inflammatory bowel diseases, such as ulcerative colitis or inflammatory bowel diseases. Patients who have inflammatory bowel diseases can often be sicker and have lower blood counts, as well as abnormal X-ray tests or stool findings.